I'm using this medium to invite the Professor Olasode for University of Ife to come and do his presentation. Thank you very much.
Thank you, Mr. Chairman.
You can now share us. Okay.
Can you see it now?
Yes.
Okay.
Yes, we can.
Okay. Okay. Good morning, everyone. And I want to say a big congratulations for this day and the fact that we can all get together to have a chat. I am Olayinka Olasode, a professor of dermatology from Obafemi Awolowo University, and I'm the coordinator of albinism total care in Obafemi Awolowo University Teaching Hospital, which has been in existence for quite a while. Since I have very little time, I'll just go straight to the presentation. The topic is albinism, united in making our voices heard in the healthcare system. It's important that this topic is quite important and it's coming at a very good time. We don't want to repeat what the others have said about the genesis of International Albinism Awareness Day. The day we know is designed to protect and to preserve the rights of the people with albinism to life, dignity, security, as well as their right to not to be tortured or have any cruel, inhuman, or degrading treatment or even punishment. I have put up a slide here to show that we must be one. And that is why this topic of this year is so germane, united in making our voices heard. What is albinism? It's been repeated over and over again, and I think I've also gained a lot. We know it's a group of inherited condition. As a person, I don't believe that it's a disease. I believe that it's a condition where we have reduced or no pigment melanin, which gives the brown coloration to our skin. And that is not the end of the world. The pigment is produced in our body by a cell we call a melanocyte, not only in the skin, but in other parts of our body. And that is why the condition affects our skin, our eyes, and the hair. In oculocutaneous albinism, as said by our somebody said it this morning, that both parents must carry the gene for a child to be born with albinism. So that is straightforward enough. I want to say that we have two types of albinism. The one we call oculocutaneous affects the skin and other areas. Everywhere is pale, the hair, the skin, and the eyes. But we also have another type we call ocular albinism. I'm sure many of us had a story from Ilorin where we had the lady with the blue eyes who was not treated properly by her husband and her husband's relatives. So this is ocular albinism, in which though your body is the color that is, brown or black, your eyes may be blue. But there are other types of albinism which we must know about so that we can look for medical intervention. We call this one syndromes. That is, some people have albinism plus some blood disorders. And when this is there, you need an intervention, a medical intervention. It's called a syndrome. I won't want to bother us with the big names. The second time is albinism with neurological disorders, in which a person who has albinism may have some other neurological problems. That is nerve problem. The spine being involved, sometimes very bad hearing. So these are syndromes. I've told us there are three types: the oculocutaneous, which is very common, the ocular, which involves just the eyes, and then the syndromic that has some other problems. This chart is just to tell us about the participatory care for person with albinism. It's important that we must know that apart from the medical intervention, other areas must be attended to: the psychological support, the skin care, the eye care, the social welfare, and a support group is essential. Also, we need family support. We need community support for the person that is living with albinism. This is a slide just to show us about healthcare needs of a person with albinism. We can see the ambulance. Most times we don't need the ambulance. It's just to show us a figure of the healthcare delivery. What are the healthcare issues in people with albinism? Dermatology, and you need care with your skin. The dermatologists are there, leading the role in taking care. I have been a dermatologist for almost 30 years, and I've seen a lot of people living with albinism. Ophthalmological care, that is eye care, is the next, with reduced vision, photophobia, transparent iris, ocular nystagmus, and strabismus. I've seen some complain that people complain about the movement of their eyes, rotating so fast, and that is classical for nystagmus. You need surgical and plastic surgery for removal of large lesions. We had somebody from one of the Southwest recently where we removed a large tumor from the chest. So we need plastic surgery to make the chest where we have removed the lesion, when it's too big, we want to make it, or maybe transfer the skin flap so that it can heal very well. What about mental health problems? In a survey, we found that a lot of people are undergoing a lot of pressure for their conditions, leading to anxiety and depression, and people feeling alienated. So when we refer you for mental health consultation, it's not because we are saying that you are mad. No, we want a doctor to help you so that you can handle the condition better. You can also get consultation from psychotherapists who will discuss with you that you are complete the way you are. Also, dental care for the ear, nose, and throat care. All these are incorporated into the care of people with albinism. Social issues from discrimination and stigma can affect educational and job opportunities. A lot of people living with albinism have complained that they cannot get jobs. We tell them to contact the doctors. We tell them they can do the job exactly as the way any other Nigerian can. There is support from family, so when they want to come to the hospital, the family can come with them from the community and donor agencies and governments. So the greatest enemy that the people living with albinism have is sunshine. Recently, the temperature has been in the 30s. We need sunscreen. Sunscreen is essential, is crucial. The problem is that it's too expensive for us. That is why we are looking for donor agencies. In the Southwest, I have brought a few and I will distribute it. I have a sponsor that have given me a few. I will distribute it, especially first to the people who are going to attend our program by virtual at 2 p.m. You need a wide brim hat. You need dark glasses, umbrellas, which I distributed last year to some people. And then we need a cover cloth so that we can live like normal. We don't have issues. Sunscreen, wide brim hat, not just face cap is not enough. Dark glasses, you need umbrellas in this season because of the sunshine. And then you have a cover clothing. Sunscreens are two types. Don't just pick it up from anywhere. We have a chemical one, which is actually having a hot debate at this time because there are some chemicals in it that can also cause cancer. Well, the studies are still going on, but we have to be careful. Make sure that your doctors know where you are getting your chemical sunscreen. The other type is physical blocker sunscreen, which contains zinc oxide or titanium dioxide. And these ones are actually broad spectrum. And these are the ones that we use for children and babies that are under 6 months. If you cannot afford sunscreen for the meantime, there is a powder in the market that is called Moju powder. It contains zinc oxide. You can, for some time, still use that, even though it will look messy on your face and your body, but at least it's better than nothing until we can canvas enough, like I'm doing, that we'll be able to produce sunscreen in this country. That is one of the research that I'm doing currently, so that sunscreen will be available to us. Broad spectrum is better choice. If anybody gives you spray sunscreen, it can be highly inflammable. So be careful when you spray. It can be inflammable and it may go into your eyes. So be careful when you see the spray type. Now, this is a picture of the wide brim hats, very wide. Don't worry, I wear them too. It's not only for church. In the hot sunshine in the north, you see a lot of people. Please get yourself a wide that will cover your face and the back of your neck. This is the Niger Delta-like hats are also very good. You can buy them in markets, you know, the type that the Niger Delta people wear. So that can be good as a covering. And this is a two-way sun shield cap, which I intend, if I can sew them, I will make them available. Or if you can sew them, or if I can get them from outside the country, look at it. It's covering the face and it's covering the back of the neck so that very little sunshine can get to these areas that are prone to squamous cell carcinoma. It's indeed a tragedy that we have lost some of us to squamous cell, and this can be preventable. So we should take into cognizance, not just face cap, please. Just consult me. Let's plan to get properly covering caps for everybody. These are sunscreen clothing. They are, you know, they have SPF value, and if we can get them or sew them, you know, they are not just hijab. You know, they cover those vulnerable areas so that sun cannot get to them. It's good to fight your enemy properly. Our enemy to our skin, to the people living with albinism, is the sun. So we have to get it. Either we sew it, our local tailors can design it. So the various support groups can have this in mind. You know, when I sew some, I will show it, I will send it to the support groups. Now, there is strength in unity. You see, our topic this year is we are united to making our voice heard. Love and togetherness is important. I'm working all through the Southwest, and I have found that the togetherness is a challenge in our midst. We need one voice, not voices. One voice together. Until we become one voice together in the health system, in the government, we cannot achieve much. Where, you know, there is dissemination or improper dissemination, we cannot achieve much. There should be a hierarchical order, you know, so that things, it is essential, so that from the top, the goodies can flow from the top to everybody in the village, in their homes, in families. It is important. It's part of our health consultation. Justice is necessary. You know, it's very sad that we still have in this day and age people that have money with them, and yet there are people dying from sun damage. Justice is important. Transparency, as has been earlier highlighted. If a support group leader and you are giving sunscreen, please distribute to everybody. If we can be this passionate, you know, though the caregivers, let what we distribute, let it get to the right quarters. Everybody deserves a sunscreen. And that is one of the advocacy that we should shout. People must not die early because they are living with albinism. And there should be a smooth transition between people when leadership changes. We need to reform our administrative hierarchy. If not, we cannot collaborate with you. We cannot collaborate with the leaders. If we know that when we collaborate with them, the healthcare we want you to access is not getting to you. So your national leader should be somebody that all of you democratically elect. And there should be a constitution putting this leader in place, a compassionate leader that will allow treatment to get to every quarter for the people with albinism. Other executives should be also seasoned people that you have tested, who also themselves know the know-how or have to give medical care, you know, have information so that they take care of themselves and they take care of others. The regions, I noticed that the regions should be directly under the national. The states should be under the regions, and the NGOs should be under the states. So you have this flow, you know, chat flow that works effectively, so that when we deliver healthcare, we can make some, it can flow right down to the person living with albinism. You talk about a voice. Keywords in having a voice is to inform and receive information. You can get a lot of information now. Inform yourself, listen to health talks, interact with other people living with albinism, other people that are not with albinism, negotiate with each other, network. Don't work in isolation. Let everybody come together. Let there be a network for health aspects of taking care of people with albinism. Let there be linkages. If there are linkages, you can link with people abroad, like I've done. That is why I brought how I got this sunscreen that I brought home when I was on a personal trip to Chicago. So linkages are important. Don't just sit down complaining like every Nigerian, complaining on the social media. Do something. You too can link with the next person. Create activity, shout, let your voice be heard. Do activity even at the state level, NGO level, support level. Make a noise in your hospital. Make a noise in your locality. Invite people, teach them people, but that you have reduced melanin. Collaborate together. Don't fight. Don't instigate each other. Just come together. Occupy available seats or available spaces in places where you are so that your voice can be heard. And lastly, justice. So get informed, get educated about albinism. I have been opportune to work abroad as a doctor in the United States. And one thing I notice about people there is that when they are coming to the clinic, they already have sought for information to discuss with their doctor. Don't just come and keep quiet. Participate in your management. Check your own skin yourself. Read, ask questions. Doctors are there to answer the question. The doctor that does not answer the question, ask for another one. Search the internet. Now everybody has a phone. Google with the condition you have. Interact with people. Join health talks. Participate in programs. Don't sit out there. When they are doing anything, because your color is different, doesn't mean you should not join them. Let them know that you are there. Let them know that you too can offer something. Let them know that you need their respect. Let them know that they need to take care of you. Join and be active in your support groups. Don't be an island. Don't complain. Join. Do something. I am doing something. Even though I'm not with albinism, I am doing something because I have a passion, because I am your doctor, because I don't want you to have cancer. I want you to live well. I am doing something. Not that it's easy, but I am doing something. Do something. Don't just stay in one spot. Let the groups associate and interact with general public. You can do health talks. You can do radio talk. Be prominent. Dispel health myths. You can imagine somebody asking me that people with albinism must not eat salt. I say, you are ignorant. You should go and read. It's not true. There are too many misconceptions about you. You are a normal human being. Let people know. Tell them. Talk to them. Make use of the media. Make noise. Talk on radio, television. Tomorrow, I have a radio program where I'll be talking, and some people with albinism are going with me. Do internet. Start magazine at your regional level, state level. It's called the magazine Albi, Albo, but start a magazine, disseminate so that people will know about you. Let them know you are there because people don't know. Be available to occupy prominent public offices. Yes, the chairman of the Bar Association is with vitiligo, which is extensive and is functioning. Public offices, I'm looking for that day when a person with albinism will be the president, will be in the Senate, will be in offices, big offices. The incapability cannot deter you because there are facilities to treat those conditions. Encourage the young ones that they can make it. They can become anything. I have a doctor I've trained who is now going to speak this afternoon at my own virtual program. Imbibe negotiation, political skills. Teach yourself how to do politics. If tell them you are not going to vote for them, if they are not going to supply your need, you are a Nigerian. What are they doing? What is the skill? I set aside a special clinic. Let them set aside something special for you. Let them create a post where a person with albinism can be to talk about your health issues. You must network, link, collaborations with the health sector. So these are the united voice when you are together. This is it's not an NGO, it's just an initiative that it will be talking this afternoon at 2 p.m. With the Zoom. You can get the Zoom link. We are speaking, and Comrade Abegune is one of the speakers this afternoon. We are going to speak about uniting and making our voices heard in the healthcare, in our support group, in advocacy, and in the workplace. So if you want to join us, this is something I've been doing for some time. This is me in my office. I'm a professor of dermatology. I'm a doctor of many years standing. And this is the last gathering we had last year at the Obafemi Awolowo University. And that is Ifeoluwa, a person with albino that is speaking to the audience. We had almost about 150 people with albinism joining us last year. It's capital intensive. There are no grants. Myself and members of this initiative paid for it all, giving transport money and everything. You can be like that. If you have anything you have, it may not be money, you can share with others so that their healthcare can be taken care of. There are projects that are on to develop sunscreen in my university. I'm working with the pharmacy. When it's ready, I will let you know. So albinism is beautiful. Some people are bleaching their skin and we don't need to do that. So albinism is beautiful. Say no to discrimination. Anywhere you are, correct people. Don't crouch, have confidence, lift your head up. Collaborate with health agencies. I'm here. We want you to be with us in our activities. We are not here to disrupt at all the support groups. We are not there to disrupt. We are not there to talk about politics among people with albinism. No, but we care. We just want you to access what we have. Years of experience, over 30 years as a dermatologist, and other doctors are with me. We have specialist consultants in plastic surgery, in surgery. We are there to help you. We care and we want to collaborate. We are already collaborating, but we expect that you will be with us. I want to say a big thank you for this opportunity. I want you to try as much as possible to join the afternoon session, which we will do. Any questions I will take, but very short questions so that I can prepare for our session. Thank you, everybody. Thank you.